The goal of Hristotherapy is liberation of the client for personal growth and fulfillment. In each session, we seek to clarify their experience, reveal conflicts within their expectations, and instill attitudes that encourage learning. Beyond this, the client is master of their journey. On that journey, we recognize that the external reality is valid. For example, subconscious acceptance that they can be wealthy is not enough to make the client wealthy. They must schedule their day with activities that transfer resources from others to themselves. Similar considerations apply to athletic performance, musical skill, and social acceptance. Transactive therapy is powerful in that it reveals the subconscious landscape that is invisible to our peers. This is essential to the executive on approaching the podium who finds their feet dragging across the carpet. The subconscious may be holding on to a memory of crushing failure in childhood and intervenes to prevent repetition. This is an obvious correspondence, but what of the client with growing gluten intolerance who prepares for the weekly all-hands with a breakfast bagel? If the intolerance arises about the time that promotion was offered, the subconscious mind may conclude that we lack the psychological strength to fulfill our role. Following that loss of self-trust, it may be years before we allow the subconscious to reveal that we need to stop eating wheat. And finally, the most difficult case arises when the meeting is scheduled during the window in which the body is processing breakfast. A subtle drop in metabolic reserves corresponding to the release of a digestive hormone now becomes a serious threat to our survival. Witnessing when falling asleep at night the potential cost of that coincidence, the subconscious allows social considerations to influence the timing of digestion, with wide-ranging effects that can be almost impossible to diagnose. We have a mystery illness that leads to medication that further destabilizes our organism. The subconscious, reeling under that chemical betrayal, may fall into depression. This scenario emphasizes the need for collaboration with other wellness practitioners. In this presentation, you will gain a framework for managing those collaborations. This is not a casual requirement. In some cases, collaboration is mandated by law. What you will also learn, however, is that transactive therapy may be actively opposed by clinicians who believe that it interferes with objective medicine. We will discuss strategies for managing that resistance. Here's the roadmap for this lecture. We will begin with a discussion of holism, that the wellness of any aspect of our being influences the other aspects. This is evident in the boundaries that exist in psychology itself, which also impinge on non-clinical practitioners such as Hristotherapists. We will chart that landscape. Violations of those boundaries can be enforced by law. California is sophisticated in its support of holism, which is enshrined as a matter of consumer choice. I will offer one strategy for ensuring that client initiative does not enmesh us in criminal conduct without conceding control to clinicians. In other words, we do not allow clinicians to decide whether or not we can treat a client. It's the client's initiative to choose that. We then confront the subtle problem of social discretion and how it relates to marketing. Finally, for those inspired to set up a private practice, I survey the market forces that must be overcome to achieve business success. When I follow the learning proposition back to the beginning of life, my mind boggles. Receiving the payload carried by the sperm, the ovum adapts, dividing again and again. Through that division, the cells influence their fellows, triggering differentiation. That potential is guided by the presence of the incarnating spirit, with nerves becoming the primary channel for integration. In dialogue with the tissues, the brain organizes itself, stimulating further cellular growth and differentiation. As this interplay becomes established, the boundaries between mind, body, and spirit become tangled, frustrating any ambition to interact with one in isolation from the others. We suggest this with the phrase triune experience. Of course, people try to simplify, as ignoring complexity grants us the illusion of control. The disciplines named in the diagram reflect the principal avenues for managing the triune experience. At the intersections between psychology, medicine, and religion, practitioners of psychotherapy, psychiatry, and Eastern medicine seek to bridge the gaps. It is only in transactive therapy, however, that we can penetrate down to the pre-verbal networks, where the three aspects of life are enmeshed. In describing therapy, Milton Erickson testified that he never knew what was going to happen in trance. The client, seeking wholeness, seemed to reach through him to call up the wisdom that transformed their expectations. In mediating such self-awareness, the Hristotherapist enters through the gateway of the mind. We offer words that instill attitudes that encourage deeper networks to explore partnership with the conscious mind. This sounds dangerously deep, but rest assured that there are powerful circuit breakers in place. Consider a client ruminating on self-abusive thoughts. You may spend months waiting for them to remember the content of the trance work. Despite being encouraged to partnership, the subconscious will push the conscious mind aside during trance work so that it can soak up your positive affirmations. Breakthrough occurs only when the subconscious is convicted that the conscious mind is committed to giving up self-abuse as a method of motivation. This investment of time and energy is only justified if the goal is healing of the divided mind. While the division persists, symptoms will migrate and syndromes develop under external pressure. For safety, the subconscious will hunker down and resist change. Recognizing this tendency, the vision offered in our theory of mind is an essential foundation. The subconscious will only commit to collaboration if it is assured that the effort will be rewarded with a transformed life. This requirement, unfortunately, undermines the social contract that we have with clinicians. They are paid to, quote, heal us, unquote. Western allopathic medicine manifests the outcome of that choice, completely ignoring or even denying the influence of spirituality. Even psychotherapy has retreated to the theater of the mind, truncating the Buddha's wisdom as cognitive behavioral therapy. Holism, conversely, is the view that the elements of our experience cannot be addressed separately. Each discipline works inwards to the center, often led by those who have been marginalized. Massage therapists start with the body and move inward through Reiki. Personal trainers introduce cognitive behavioral therapy. Pastors resignify scripture and psychological terms. As Hristotherapist, we step firmly into the triune experience, trusting in the client's wisdom. Yes, you will want to study anatomy and the world's great spiritual teachings. That knowledge will prevent you from crossing wires as you navigate the inner landscape, and perhaps enable you to achieve results more efficiently. But somewhere in each client's experience are memories of greater well-being, and in those memories are the seeds of imagery that can be nurtured to achieve collaboration against the divide of the critical mind. Those seeds may be revealed in dreams or spontaneously in response to our encouragement. We ask in moments of deepest frustration, is there anything that you can imagine leaning into? It doesn't have to be a person or even a living thing. Just allow your subconscious to speak to you. As Hristotherapy seeks to change attitudes, we are identified as mental wellness professionals. At the top of that pecking order are scientists. From our study of learning, we know that science describes the behavior of things that don't adapt. Given the adaptability of the brain, applying science to mental wellness seems a dicey proposition. In fact, the history of clinical practice is dominated by fads that, when popularized, harmed the public interest. I recommend The Mind Fixtures by Anne Harrington for an up-to-date survey of those abuses. Nonetheless, if a client enters our office with a knife stuck in his forehead, we are going to call an ambulance. The same is true if the presenting issue involves head pain or dizziness. These symptoms suggest that the brain is threatened by permanent damage from physical causes, such as internal bleeding or cancer. That some brain surgeons went so far as to treat mental illness by separating the halves of the brain with an ice pick. Well, desperate measures in desperate situations rarely yield positive results. As concerns electroconvulsive or shock therapy, the jury is still out. When no obvious physical condition exists, caregivers observe that inner conflict manifests with characteristic behaviors. Schizophrenics struggle to distinguish imagination and perception. Depression manifests as lethargy, and anxiety is unfocused physical attention. Clinical researchers seek to categorize pathological behaviors to facilitate the development of effective therapies. In America, the categories are published in the Diagnostics and Statistical Manual, or DSM. Currently in its 5th edition, the DSM is difficult to apply, with overlapping symptoms that tempt clinicians to reach a diagnosis within their area of specialization. Worse, it has been observed that popularization of a new diagnosis is followed by a surge in cases, with a broadening of symptoms that drives overlap with other conditions. For these reasons, only licensed clinicians are allowed to diagnose against the DSM. If a client enters your office and claims, "I suffer from depression," always redirect with, "That's a clinical condition. Can we focus on how your mood limits your ability to enjoy life?" In a clinical setting, assuming a successful diagnosis, 2 broad approaches are pursued in treating the patient. Psychiatry holds that inner conflict reflects hyperactivity or atrophy of networks driven by imbalance in the brain chemistry. Patients are prescribed medications, which can evolve into complex cocktails that seek to compete for side effects. The patient's hope is that once the disturbed networks are calmed, they can reduce their medication and resume normal life. In many cases, however, use of psychoactive substances continues for years, and stabilization is considered an acceptable outcome. I should note that psychiatry does not always involve medication. Magnetic stimulation and EMDR, for example, attempt to influence network activation without drugs. Psychotherapy takes a less invasive approach, assuming that mental conflict arises when the brain seeks to integrate networks that manage competing drives. Watching 2 men fight over a woman is the most basic example, involving competition between survival and procreation. Our schools of psychotherapy are organized around more subtle conflicts. Freud focused on reality and pleasure, Jung on collective and individual consciousness, Adler on convention and creativity, Skinner on private and public conditioning. Therapy investigates the specifics of the internal conflict and introduces new concepts and behaviors until healthy integration is achieved. If you are going to investigate psychotherapy, I recommend Irvin Yalom's existential psychotherapy. Yalom recognizes that mental conflict is soothed through relationship, and he offers a simple but comprehensive scheme for analyzing inner conflict. As a materialist, Yalom holds that conflict is inevitable, since we can never fully know another person. Therapy teaches the patient to negotiate behaviors under that constraint. The goal is to find a home, a place in which we are known and valued, with love being the medium of exchange. In the 21st century, the 2 clinical disciplines are working toward a grand synthesis. Biology and culture impose regularities on the development of the brain, aligning neurochemistry with psychodynamics. Dopamine associates with attentiveness. Serotonin, the neurotransmitter, associates with the psychological principle of reward. And the neurotransmitter epinephrine associates with safety. Unfortunately, psychiatrists and psychotherapists are constrained by licensing to avoid overlap. So integrated therapies occur only in a combined practice. Some clients will present as refugees from clinical methods. Others, suspicious of one-size-fits-all approaches, will nonetheless use clinical terminology to analyze their conflicts. We need to avoid clinical pretensions, always refocusing the conversation around, what do you want to be able to do? Scientists have convinced us that they are disciplined by physical laws. False practices will be exposed by competitors searching to solve the same problem. Unfortunately, no two people have the same social experience, and so the therapy offered to one person does not necessarily apply to any other person. Worse, the remote clinical perspective can discourage self-revelation by patients who may choose in institution settings to tell the clinician only what they want to hear. Counselors are disciplined by professional ethics, often backed by law. They provide services that help the client realize an ambition, where in a clinical setting, services are evaluated for their impact over many cases, including possible failures. With a counselor, each client determines themselves whether service is satisfactory. The counselor's code often addresses the logistics of service termination, with ethical practitioners cooperating in transfer of their responsibilities to a replacement. As concerns personal growth, we should be rigorous in the terminology of response development. Transactive therapists help the client design their personality. We offer psychological insights to support that outcome. Life coaches often market an inspirational life story, guiding their clients through experiences that instill new attitudes. Advisors help clients manage risks, particularly as pertains to major life choices, such as home purchases or retirement planning. The client is relieved of the need to learn complex skills and is often guided by referrals. Ministers finally introduce clients to spiritual experiences that have been suppressed by scientific materialism. They are responsible for managing their community to prevent corruption of that deep intimacy. All counselors have the opportunity to abuse the trust tendered by their clients. Conversely, the narrow focus of the relationship brings clarity concerning outcomes that helps clients manage their vulnerability, learning lessons that apply to other relationships. In networking, you will encounter counselors who assert that they do what therapists do. Within certain limits, that is true. Effective counseling always depends upon familiarity that deepens into rapport. The support of an effective counselor relieves client anxiety, particularly in adversarial experiences, such as a lawsuit or home purchase. As therapists, however, our job is not only to relieve anxiety, but to ensure that all aspects of the personality are fully aligned when a goal is chosen. Where other counselors manage the client's relationship with the world, we help clients navigate and take ownership of their relationship with themselves. What most counselors apply is simple psychology. They analyze people's motivations and seek to give them what they desire. This is sometimes dangerous when coupled with pop hypnotic methods. You will encounter life coaches, financial advisors, and even car salesmen who have learned NLP, neuro-linguistic programming, this subdiscipline of hypnotherapy, and apply it in motivating clients, dropping thoughts into the subconscious that have devastating effects on self-esteem when the client realizes that their decisions were driven by the values of their counselor. The only reliable exceptions are Buddhist gurus. Recognizing this, psychotherapists are building schools around meditative practices. I recommend Dan Siegel's Mindsight. Buddhism, of course, contains much more, including a comprehensive model of personality, the Eightfold Way. However, Buddhism does not recognize the division of the mind except implicitly in that enlightenment corresponds to the healing of the division of the mind. As an outgrowth of earlier Vedic teachings, Buddhist gurus will often introduce the chakras, which presage the stages of development, though that connection has become muddled with hoary mysticism. Where scientists are disciplined by reality and counselors by their clients, co-conspiracists seek to ingratiate themselves, so to speak, with our inner conflict. This is called enmeshment. Relationships with family and friends are the forum for securing the two primary biological drives, survival and procreation. When these drives are not managed maturely, vulnerable parties suffer deep wounds that they shield with compensatory behaviors. Driven by self-protection, these behaviors frustrate healthy relationships. The difficulty is greater because with enmeshment, the critical mind and self-concept are incompletely formed. Sufferers are functional only in the company of their abuser. This builds a generational legacy passed from parent to child that frames therapy as breaking the chain. The illusionist presents as a counselor, but manipulates the client's self-perception to secure dependency. The illusionist is driven by financial opportunity. Like a snake oil salesman, they have the solution to every problem. This proposition is shielded by the claim that the client is responsible for their own success. In some sense, these claims are related. Illusionists practice what they preach. They impose their model of reality upon their clients. Recalling our place in the wellness landscape, we may be tempted by the illusionist's role. Given the critical role of the subconscious, some hypnotists promote themselves as miracle workers, with corresponding ethical lapses. In the 90s, clients might have left a one-day weight loss clinic with a craving for cigarettes. Single session therapies could leave clients with permanent disabilities. John Kappas reported treating a client who was unable to sleep. It is for these reasons that California defines hypnotherapy as vocational and avocational self-improvement. We do not solve a client's problems. We help them to identify and soften expectations, unleashing self-expression that leads to growth and fulfillment. At the bottom of the therapeutic pile are cultists, self-promoters that impose total control over their adherents. Survivors of childhood abuse may be particularly susceptible to their embrace. Co-conspirators are threatened by independent decision and so will resist therapeutic gains. We should expect that power imbalances may force clients out of therapy before our work is complete. Do not be dismayed. Trust rather that the seeds planted within will continue to grow, shifting the balance from conspiracy to collaboration. You may be bewildered by the landscape that we have surveyed. Dr. Walter Freeman, the brain surgeon who promoted the lobotomy, might be considered an illusionist or even a cultist. In every industry, society has an interest in preventing such abuses. Our business codes create those safeguards. Business codes vary from state to state. Some, such as Oklahoma, are open practice, assuming that market forces will reward therapeutic integrity and competence. Others, such as Washington, impose minimum training for lay practitioners and require registration. Recognizing this variability, here we simply summarize the goals that motivate lawmakers. A public utility is not a movie theater, is not a legal practice. Different businesses require different regulations, and so codes set up business categories. Once those categories are established, however, profiteers may target markets without learning necessary skills. For this reason, we are prohibited from using terms in our advertising that imply, for example, medical competency. We can offer to help the elderly adjust to assisted living, but not specifically elders with Alzheimer's, which is a medical condition. Where we rely upon the body's natural healing powers, the clinician intervenes to prevent disability and death, weighed against potential side effects that might impede recovery. Their specialized knowledge takes a decade to master, and even so, clinicians pool their knowledge to achieve best outcomes. Recognizing this investment, states established licensing boards to ensure the competence of clinical practitioners. The principal advantage to practitioners is qualification for third-party reimbursement under insurance plans. While some states are extending coverage to hypnotherapy, in most cases we are covered only when a clinician refers a patient for adjunct therapy. That is rare. While all this machinery predisposes consumers to seek clinical care, sophisticated regulators recognize that cost control measures limit consumer participation in decision-making. While in the abstract this should not affect outcomes, the subconscious is constantly assessing how to allocate resources to ensure our survival. If a part of the body is broken, for example, it will atrophy. Non-invasive rituals such as acupuncture and chiropractic focus the healing work within, as well as providing measurable therapeutic benefits. Similarly, supplements provide building blocks necessary for growth and repair of our tissues. Mental wellness counselors help clients manage mental balance in the stages before clinical care is necessary. We also facilitate personal growth, which is not an ambition covered by the Diagnostic and Statistical Manual. Returning to our example above, be aware that even those under a psychotherapist's care may have goals that are secondary to their clinical condition. So long as they independently define and assess progress towards those goals, they are allowed to engage a counselor to that end. It is only when we write therapy for narcissistic tendencies that we expose ourselves to legal action. You can go to jail for practicing psychotherapy without a license. The therapeutic container, when a client comes into our office, is best thought of as a greenhouse, a space protected from the elements in which new growth can become established. For this reason, we never reveal the identity of our clients. This extends to social encounters. When working with a neighbor, we counsel that we will engage in the supermarket aisle only in response to their initiative. This protects them from the stigma associated with therapy. As concerns friends and family, we can become caught up in the contradictions between our professional conduct and the vulnerabilities revealed in intimate settings. The client gains leverage that can be both personally and professionally damaging. We should refer to a competent peer rather than enter into therapy with friends and family. Recognizing that we enter into trance with our clients, we must guard against romantic entanglement. As social confidence builds, the client will seek to exert control over therapy, often indulging romantic energies that have been suppressed. Celebration of that tendency should be coupled with firm encouragement to seek a relationship with a peer whose virtues inspire them. The deflection of romantic fascination is a specific example of a larger issue. A dictum of combat is that offense is the best defense. For this reason, defensive personalities often justify aggression with hostile reasoning that offends our healing sensibilities. The reasoning must be noted without rebuttal. We ask, when did you first feel this way? Or, how would you treat someone in your situation? Both lead towards unveiling of the virtue that blooms in the protection of our unconditional positive regard. As newfound strength facilitates new experience, hostile attitudes will soften. Conversely, a lack of discipline bleeds poison into the trance experience that will destroy rapport. If you cannot find good in your client, refer to another practitioner. These training materials are offered as a public service. Mental pathology is an epidemic that can only be stemmed by education. In sharing the information you learn here, you may protect and inspire those confronting the infection. Paradoxically, this benefit is stifled by psychology itself. While Martin Seligman worked to shift psychology from pathology to wellness, he failed to grasp that healthy relationships are beautiful because they are creative. You can't instill a universal set of virtues. They can be discovered and applied only in a suitable social context. Positive psychology was thus stillborn, and our mental wellness industry is dominated by the language of pathology. This conclusion is entrenched to the degree that psychologists, though fascinated by the concepts offered here, will not engage them. Despite being a synthesis of ancient and modern wisdom, these teachings are not recognized as a clinical school. Historically, insurers responded to the epidemic by restricting services. This changed with the Affordable Care Act. Though the number of sessions are limited, consumers pay a premium that covers therapy, building a bias towards clinical services. Even when not formally recognized, trance is always a part of therapy. It's just that unless cultivated explicitly, the client approaches it haphazardly. Worst, the intimacy of trance also exposes clinicians to the psychotic impulses of their patients. For this reason, the methods of Milton Erickson have been replaced by less intimate techniques. Eye movement for desensitization and reintegration, or EMDR, and polyvagal therapy are examples. For clinicians that have themselves crawled out of the pit of self-destructive behavior, acquired strength makes exposure therapy a tempting alternative, though I can't help but offer the parallel of using a car crash to cure driving phobia. Most recently, psychiatrists are heralding psychedelic therapy as a method of interrupting the ruminations of the default network, which is in effect the conscious process. I am dismayed that they denigrate the essential protective role of the critical mind, and concerned that the drugs influence the brain for up to 2 weeks after administration. Psychedelics like an off switch. We count people out of trance because to remain exposed to social shocks can have long-lasting negative effects. The arcane formality of these procedures reflects in part the lack of a positive model for collaboration between the conscious and subconscious realms. Freud rather proposed a frightening image of the subconscious that is parlayed sensationally by entertainers. As described in a prior lecture, the stage hypnotist volunteer begins to escape trance once their sense of personal propriety is offended. To be completely ridiculous is possible only with volunteers who despise themselves. Despite these inner protections, we must also recognize the lack of formal licensing supports an exploitative culture. Our clients are vulnerable people, sorting through anecdotal claims that cannot be checked against a public record. Worse, many clients reach out to us because chronic malaise has forced the subconscious to seize control of waking experience. Illusionists and cultists can exploit this vulnerability. Given this market context, how do we build a practice? Endurance is key. To convince a community of your personal integrity can take years. Secondly, we can focus on the positive benefits of therapy. Prophylaxis, preventing conditions from aggravating. Holism, ensuring that your mind is working for your overall wellness. And empowerment, you are captain of your own ship. In this model, we hide amidst the cohort of four-year graduates parlaying their psychology degree into a life coaching practice. In that market, we differentiate ourselves with far more effective tools for unleashing the potential within our client. So let me summarize. Hristotherapy as regards the challenge of entering into a commercial space to provide these services to our clients. First, Hristotherapy activates internal wisdom, unleashing natural healing processes. In navigating the road to wellness, clients will be tempted with self-limiting quick fixes offered by other kinds of practitioners. They will also face resistance from their intimates. While we bring benefits to any healing process, by law, we often must cede authority to clinicians, authority and sometimes even initiative. While not bound to secrecy, we hold the client relationships as sacred, always acting to safeguard their social standing. And finally, business realities are difficult. Our lecture today sought to orient you toward the value proposition of Hristotherapy. In an area of specialization, we empower clients to understand their choices. Part of what the client pays us for, however, is to safeguard their autonomy with the recognition that we don't have all the answers. They will need insights from specialists. As specialists have a narrow focus, we serve as a sounding board, collecting and organizing insights so that the client can assess the benefits of each approach. Even among clinicians, to claim to heal reflects pride. The best that a clinician can do is prevent decay. When the condition is arrested, it is our body and our mind that restores lost strength. In encouraging clients to own that resilience, our humility is a therapeutic virtue.